So let's kick things off with a question that I'm sure a lot of us have wondered about at some point. What really is the difference between just having some chest pain and having a full-blown heart attack? By the end of this, you'll know how to decode what your body's trying to tell you. And it all starts with what you can basically think of as a plumbing problem in the heart. You see, the entire story of coronary artery disease really begins with this one process. And a great way to think about it is like having clogged pipes in your house, but in this case, the pipes are in your heart. The medical term for it is atherosclerosis. At its core, atherosclerosis is actually pretty straightforward. It's just this slow, steady buildup of gunk, doctors call it plaque, inside the arteries that feed your heart muscle. Over years, this plaque narrows the artery, just like a pipe getting clogged with grime over time, making it harder and harder for blood to flow through. So, what causes this plaque to build up in the first place? Well, it's not just one thing. It's usually a combination of factors. Some of it is out of your control, like your family history, but a lot of it is tied directly to lifestyle. Things like diet, smoking, high blood pressure, you name it. Each one of these can add another layer to the slow clogging of those really critical arteries. Now, for a long time, this clogging can happen completely silently. You might not feel a thing, but eventually your body starts to send out a warning signal. The best way to think about it is like the check engine light on your car's dashboard. And in medicine, this warning light has a name: stable angina. So what makes stable angina stable is its predictability. It follows a very specific script. You exert yourself. Let's say you're climbing a flight of stairs. Your heart needs more oxygen, but that narrowed artery just can't deliver enough. That lack of oxygen causes pain. But here's the key. As soon as you stop and rest, the pain goes away. It's a clear, repeatable warning. And this isn't just a static condition. It can get worse over time. Doctors actually classify angina into 4 different classes. As you can see here, it starts with class 1, where you might only feel pain during really heavy exercise. But it can progress all the way to class 4, where even the simplest movements can bring on that discomfort. It's a scale that really shows you how much this clogged pipe can start to limit your life. But what happens when that predictable warning sign suddenly changes? This is the absolute critical turning point. This is where a chronic problem becomes a full-blown medical emergency, something known as an acute coronary syndrome. Okay, so here's the game-changing event. That plaque that's been building up for years, its surface can become fragile, and it can suddenly crack or rupture. Now, your body's natural response is to form a blood clot to heal an injury, right? But inside an already narrow artery, that clot can grow so fast that it creates a sudden, severe, or even a complete blockage. And this right here, this is the crucial difference. On the left, you've got the familiar pattern of stable angina. Activity causes pain, rest makes it better. But on the right, that whole pattern is shattered. The pain becomes unpredictable. It happens even when you're just sitting there, and resting doesn't make it go away. This is unstable angina. The check engine light is no longer just on, it is flashing bright red. And if that blood clot causes a complete and lasting blockage, well, that's when we've reached the most serious outcome, a myocardial infarction. We all know it as a heart attack. The heart muscle that's supposed to be fed by that artery is now starved of oxygen, and it literally begins to die. So how do doctors in the ER tell the difference between unstable angina and an actual heart attack when the symptoms can feel so similar? It all comes down to a blood test. They look for something called cardiac enzymes, like troponin. You see, when heart muscle cells die, they burst open and release these enzymes into the bloodstream. So if those troponin levels are high, it's confirmation. It means heart muscle has been damaged. That is the definitive line between unstable angina and a heart attack. The moment a heart attack is confirmed, everything becomes a race against time. The goal is simple, it's urgent, and it's all that matters. Get blood flowing back to that starving heart muscle as fast as humanly possible. In the ER, they have this powerful phrase that they live by. Time means muscle. It's a stark, simple reminder that heart muscle is not like other tissues in your body. It doesn't regenerate. Once it's gone, it is gone forever. Every single minute that ticks by without blood flow means more permanent damage. So, immediately, a whole protocol just kicks into gear, often starting right in the ambulance. Chewable aspirin to start attacking the clot, oxygen to help the struggling heart muscle, nitrates to try and open up the blood vessels, and morphine for the intense pain. These are the first critical steps to stabilize the patient while the team gets ready to clear out that blockage for good. But, stabilizing is one thing. The root problem, that physical blockage, is still there. So how do doctors actually go in and unblock that artery?
Well, there are basically two main strategies to clear it out. On the left, you've got thrombolysis. These are powerful clot-busting drugs given through an IV. On the right is the gold standard, primary PCI. This is where a cardiologist actually threads a tiny catheter up to the blockage, inflates a balloon to open it, and places a small metal scaffold called a stent to keep it open. Now, PCI is better, but the choice often comes down to pure logistics. It's only the best option if it can be done fast, ideally from the hospital door to the balloon being inflated in under 90 minutes. If not, the clot-busting drugs are the way to go to save that precious heart muscle. All right, so after the crisis is over and the patient is stable, the entire focus shifts. It's no longer about emergency intervention. It becomes all about long-term management and making sure this never, ever happens again.
And how do you do that? Well, this list might look pretty familiar. We've come full circle, right back to those risk factors we saw at the very beginning. The strategy now is to aggressively manage every single one of these, from controlling cholesterol and blood pressure to quitting smoking and getting active. It's all about tackling the root cause of the disease head-on. So, from a slow, quiet buildup of plaque to a predictable warning sign and then to a sudden emergency, that's the journey of coronary artery disease. If there's one thing to take away from all this, it's that your heart often sends you warnings long before a crisis ever hits. The real question is, are you listening? Thanks for joining me on The Explainer.